In today's episode, we are going over a physical therapy guide to plyometrics, return to run, speed, and agility training. Let's get rolling. So, why are we talking about this? Well, first and foremost, especially for post op patients, I think physical therapists do a very good job in the early stages of rehabilitation. And we had a lot of education on how to deal with common orthopedic surgeries. So, we do a good job. On the flip side of things, we don't get a lot of education on the end stages of rehabilitation, particularly return to sport. So essentially, if you have a post op patient and you get a protocol from the surgeon, you usually have some pretty good guidance from that surgeon up until about 3 to 4 months. And then you get a lot less guidance. And it's up to the physical therapist to learn how to bridge that gap and get back to high level of a performance for that individual. And this goes for an athlete that's trying to get back to a field sport, but it also goes for the average Joe that maybe wants to get back to some sort of jogging program, or they just want to get back to being able to play pickup sports like, let's say, tennis or basketball or soccer or something along those lines, right? And generally speaking, a lot of the advancement of impact activities is not taught in most physical therapy curriculums, right? So we have a lot of questions end up being, when is it even appropriate to start plyometric training? How and when do we transition to some of the impact activity? Also, when we are allowed to start, what do we start with? And how do we progress over the course of time? What's kind of step one, step two, step three, step four, step five? If we are going too fast, how do we know? Right. And lastly, I think a big problem is that most information that we have out there is expert opinion. We don't have a lot of clear cut medical research that shows us when we're allowed to start stage one, stage two, stage three, so on and so forth. So in today's episode, we're going to go over when is it okay to start with return to run activities, plyometric activities, right? We're going to talk about progressions. We're going to talk about very easy progressions and how to progress all the way to more advanced return to sport type activities. We'll also talk about how I like to specifically progress each part of impact. So basically, we're going to go with a return to run program first. And this is my foundation for all plyometric based activities. We're going to talk about how to return back to acceleration and sprinting. We're going to talk about how to progress through plyometric and jump training. We'll chat about change of direction and agility work. And lastly, we'll talk about conditioning. So once we've built all of these elements together, right? How do we get someone more conditioned so they can return back to sport or their activities over the course of time? Welcome to the Fitness Pain Free Show. This is where we help coaches and physical therapists like you get your patients out of pain and back to training. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and meathead. I have my dream job as a physical therapist, coach, business owner, and educator. I've been doing this for several decades now. I want to help you reach your goals, and that's the whole reason why I run fitnesspainfree.com. This is part 5 on our series on plyometrics and turn to run. If you missed 1 through 4, I'll leave a link in the show notes. I recommend watching those before you watch this one. All right, let's talk a little bit about conditioning next. So from a physical therapy standpoint, the extent of our conditioning for most of our athletes after surgery is, okay, hop on the bike. Let's do about 10, 15 minutes of warm up, and then we'll start your physical therapy, right? Now, this is not a bad start. I'm not trying to hate on physical therapists, but there's a lot more to this. And I think the other thing that's important to understand is that your fitness or your conditioning is actually going to be a risk factor for injury if it's poor, right? This is a cool study from Orthopedics Journal of Sports Medicine, 2017. And it was preseason aerobic fitness predicts in-season injury and illness in female youth athletes. Now, this was soccer players, right? And females and youth, right? So it doesn't necessarily apply to every single population. But at least in sports where things like VO2 max and conditioning are very, very important, if you have poor VO2 max, poor fitness, it increases your risk of injury. So as physical therapists, obviously we want to rehab our athletes fully. If we're not getting our conditioning up to snuff, that's actually going to increase the risk of injury. So very, very important to keep that in mind. For most athletes in the physical therapy setting, you're going to have to do a bit of a needs analysis, which essentially means that if your athlete needs a lot of cardiorespiratory endurance for the sport, like a soccer player, you have to build it up. Okay. But if they're a football quarterback, obviously those demands are going to be very different. So we just need to make sure that our rehab is going to be specific to the athlete that's in front of us. Okay. The other thing I'll say, and this goes the same for strength and power and all these other factors that are important for sports, It's easier to maintain your fitness than it is to build it over the course of time. So I'm going to make the argument for introducing conditioning into your athletes' rehab programs as soon as possible, as long as you're protecting the surgical site well. Okay. So for athletes that have, let's say, an ACL reconstruction surgery, we're not going to be able to run right away, obviously, but we are going to be able to do some sort of biking. Okay. If you have someone that has, let's say, Achilles tendinopathy, we can probably keep them running right away and maintain their fitness as long as it's not too painful. Okay. So again, really comes down to the individual, but as much as we can, we're trying to maintain conditioning because once we lose it, it's actually harder to build it back up again. Okay. And last little piece I'll say, and this kind of goes for all of the plyometrics and agility, change of direction, all the stuff we're talking about in the series. We're going to try to build up our volume first, and then we're going to introduce intensity over the course of time. And I'll tell you how we do it. So generally after a major lower body surgery, like an ACL reconstruction, we can start doing some sort of easy cycling pretty much as soon as the surgeon is okay with it. And once they have the range of motion to make a full circle. Okay. So for my athletes, and I'm just picking a number out of the hat, it's going to vary based on the surgery. I'm going to start somewhere around week 2 after a major surgery, as long as it's okay with the surgeon, right? It really depends a lot on the surgery that you had. And largely, we're not using any resistance. So week 2 to week 4, we're working on slowly building up the amount of total cycling time that we have. I usually start with around 10 to 15 minutes, make sure that's well tolerated, make sure the next day the knee's not really swollen, extra painful, all of those things. And then each session, I add a few minutes until we get to around 30 minutes. And that is going to coincide with around the 4-week mark. Okay. Weeks 4 to 8, we're working on ramping up that total volume. So we started around 30 minutes and we may work our way up to around 60 total minutes. Now, what I'll say is that this is going to vary greatly depending on the sport. Okay. I think you can make the argument for, let's say, a soccer player to work up to 60 minutes and maybe even more, right? You can do the same thing with endurance athletes. These folks are typically running 60 plus minutes throughout the course of the week. So we can probably build up to 60 minutes or more in those folks. But if you're working with, let's say, I don't know, a quarterback or a wide receiver in American football, we just don't need as much conditioning. So usually I'm not working up to as much in terms of like total minutes, right? And the idea is we introduce the stress, we make sure it's well tolerated. Again, this is all with a bicycle at first. We're not running. I'll show you how we introduce running in a minute. And over the course of time, as long as things are tolerated, we just slowly increase that stress. Okay. And all the while, we're making sure that, let's say, the area is not getting too swollen, painful, we're not losing range of motion, not getting excessively sore, all those good things. I want to talk a little bit about conditioning periodization. Okay. So if you're not familiar with the term periodization, it's essentially how do you program across the year for success, let's say during a major tournament or playoffs or whatever it is, one time per year. Okay. So your training is going to vary across the year so that you can have the best possible performance during the season. Okay. So we're looking at 2 different types of conditioning periodization. So one is polarized training and one is pyramidal periodization. Pyramidal, like a pyramid. I'll talk about why like a pyramid in a minute. But largely, these are 2 effective ways to program conditioning. And I'm not a conditioning expert, but I like to program for runners. I'm a runner myself. I work with a lot of folks that are into endurance. So I like to learn about these things. So this is coming from a journal, Scandinavian Journal of Medicine and Science and Sports in 2022. It's actually called The Effects of 16 Weeks of Pyramidal and Polarized Training Intensity Distribution in Well-Trained Endurance Athletes. Now, this study was not looking at polarized training and pyramidal training versus other forms of running periodization for endurance athletes. But one of the statements they made, it's a recent article, so I think this is pretty relevant. These 2 models, referring to polarized and pyramidal periodization, appear to be the most effective for boosting endurance performance in middle and long distance runners. Okay. So the thing is, with our athletes, we're not always working with endurance athletes. Okay. We might be working with soccer or basketball, but if we're looking to improve our endurance, these are 2 really good tried and true periodization models for you guys to try for your athletes. Okay. And these are the 2 models I tend to use for my conditioning programs for my athletes. Okay. Now, generally speaking, they'll look at elite level athletes across the world, the folks that perform the best in their given sports, and they'll look at how much time they spend in each training intensity. Okay. And they look at and they characterize training intensity by these zones. All right. So You have something called your ventilatory threshold, and there's two of them. There's one ventilatory threshold, and largely if you're running and you can talk very easily while you're running, you're going to be below the first ventilatory threshold. This is also referred to as zone 1, right? The second ventilatory threshold, once you cross it, you really can't talk anymore. Okay. So if you're going to be in zone 2, which is going to be above zone 1, it's going to be above the first ventilatory threshold, below the second ventilatory threshold. You can talk a little bit, but not very well. Okay. And then if you're above the second ventilatory threshold, it means you're working so hard, running so hard that you actually can't talk at all anymore. All right. So they look at elite level runners and they figure out how much time they spend in each of these zones. Okay. They've also done a bunch of research to figure out which style of training is most beneficial for performance, right? So if I spend more time in zone 1 versus zone 2 versus zone 3, what type of program performs the best, right? And largely they found that these polarized or pyramidal approaches work really well. So what the heck is a polarized approach? So a polarized approach means that 70 to 80% of all of your runs or all of your cycles or swimming, right, are going to be in zone 1. Okay. So the large majority of your work is going to be very easy. All right. In a polarized approach, they actually spend very little time in zone 2, and they spend about 20% of their time in zone 3. This is going to be very high level activity, right? So polarized just means you spend time easy and very hard. You're at the two polar extremes. Okay. In a pyramidal approach, think about how a pyramid is. So at the very bottom of the pyramid, there's going to be a lot more of the training. Okay. Think about like the nutritional food pyramid. At the very bottom used to be grains, right? The very top is going to be sweets. Okay. In a pyramidal approach, zone 1 is going to be at the base of your pyramid. In the middle of the pyramid is going to be your zone 2 training. And at the top of the pyramid is zone 3. So the majority of your work, just like in the polarized approach, is going to be slow. But in this approach, there's a little bit more zone 2, and then there's a little bit of zone 3 sprinkled in. Okay. So if you look at the way I make my conditioning programs for my athletes, I follow something similar to this pyramid. Okay. Just keep in mind, I think at the end of the day, specificity is going to end up winning. So we're going to utilize a pyramidal or polarized approach when we're periodizing for athletes. But as we get closer and closer to returning our athletes to sport, really the conditioning starts to look a lot more like a game time situation. Okay. So essentially, if you're playing soccer and the average sprint is going to be 15 yards, and usually there's a 1-to-4 work to rest ratio, we're just going to make our conditioning programs look very similar to the sport, make those durations last about the same amount of time, try to make sure the athlete is getting the same mileage as what they'll see in a game situation. All those things end up occurring towards the end stages of rehab. So guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain-Free Mini Course. So I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high-level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym, 4 simple steps to getting your clients out of pain, how to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to, because you can't get the patients through the door that you want to work with. Okay. So I'll show you how to do that. And lastly, we'll talk a little bit about the Fitness Pain-Free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain-Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain-Free certification. Now, the Fitness Pain-Free certification is the course, the certification that I wish I had as a new grad that fills in all the gaps in knowledge that you don't get in physical therapy school. So A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain-Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain-Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. So as we progress along, once we get to week 8, what does our conditioning program look like? Now, largely, we're just trying to go from an easy amount of stress to a harder amount of stress, all right? And one of the things we have to be a little cautious about is that if we have a major lower extremity injury, if we throw too much intensity at this injury right away, we may set the athlete back, potentially damage that surgical site. So we have to make sure we kind of ramp things up slowly, right? So around the week 8 to 12 mark, I'm going to be doing long, slow cycling at about a 3 out of 10 RPE. So again, that's around a zone 1. And then 1 time per week, I'm going to do some sort of tempo or longer interval. So a tempo run to me is going to be maintaining a pretty challenging pace. Maybe that's a 6 or a 7 out of 10 for a prolonged period of time. I also like longer intervals in this stage of conditioning. So the reason why I like tempo runs and longer intervals is because generally speaking, it's a little faster than long, slow distance, but it's not so fast like a sprint where it's too much stress to a given surgical site. Okay. So a workout may look like 2 sets of 8 minutes at a 7 out of 10 intensity with 2 minutes of a rest recovery jog, which is usually about a 3 out of 10. Repeat that 2 times, let's say. So once we get to week 12 to 16, we start to bump things up again. We're still doing some longer, slower, let's say 30 to 60-minute cycles, but now we're working on some shorter intervals as well, okay? So we went from doing a tempo run or a longer interval to a shorter interval, okay? At least to me, a shorter interval is going to be something like 3 minutes on at about a 7 or 8 out of 10 when you're doing your cycling, and 3 minutes off, which is maybe like a 3 out of 10. Kind of think about a recovery cycle. Okay. You might do this around for 4 total sets. Now, if you think about it, something that you can maintain for 8 minutes, right, is probably going to be slower than something you can maintain for around 3 minutes. So one of the ways I dose up intensity is by going from a longer interval to a shorter interval. Okay. So if it's a 10-second interval, you're going to be able to sprint that. But if it's a 10-minute interval, you're not going to be able to sprint for 10 minutes. Okay. That's not what I'm prescribing at this stage in rehab, but just so it makes sense to you. Okay. The other piece is that at week 14, we are introducing our return to run program. Okay. Now, if you guys missed the prior lessons on return to plyometrics, go back and listen through those, watch through those. You'll get an idea of how we introduce all of our stress from a plyometric standpoint. But around the week 14 mark, we're introducing return to run. So up until this point, all of our conditioning was on a bike. And now we're slowly starting to introduce some running. So what you'll find is that our conditioning goes from being on a bike to doing a little bit more running. It's just that when we introduce running, we can't do high intensity work. So for a while, you'll notice that a lot of our higher intensity work is still going to be on a bike. So at week 16 to 20, this is going to be month 4 to 5. One of the major goals is to start phasing out some of the cycling, some of the bike work, and starting to phase in running via the return to run program. So we're going to be doing 1 to 2 times a week on some sort of long, slow run. And it's going to be a combination of cycling as well as running. Okay. 1 time a week, we're still doing our bike work with a higher intensity, and we're going to stick with our shorter intervals. We can shorten them up a little bit if we'd like to. Again, it depends on the sport, it depends on the athlete, but we want to get our high intensity work in with a bike, right? Because if we introduce sprinting right away, not super effective, might end up hurting your athletes. Okay. Week 20 to 24, which is around month 5 to month 6, we're at the point now that all of our longer, slow runs, which I recommend around 1 to 2 per week still, are going to be running. So at this point, we've completely phased out our cycling. We're also starting to prescribe some of our high intensity conditioning in the form of running. Okay. So we had a return to run program. We've gotten through it. We've actually introduced a little bit of accelerating and sprinting for athletes right now. We know they can tolerate these movements well. We can start to incorporate some higher speed running in our conditioning as well. So the way we introduce the higher intensity running is going to be very similar to how we introduce the high intensity cycling. We start with tempo runs or long interval runs. So something like 8 minutes on at a 6 or 7 out of 10 intensity, 2 minutes off, 3 out of 10 intensity, loop that 2 or 3 times. With the thought process being that we start with these longer intervals and we progress to shorter intervals over the course of time. At month 6 to 7, we advance things a little bit further. So we still have that 1 time per week of a longer, slower running. One of the reasons why we're doing just 1 day per week of a long, slow run is because we're ramping up our agility work at this point. So if we do a lot of agility work plus a lot of conditioning, sometimes it's a little bit too much for the athlete. So as we start to dial up some of the agility, change of direction work, we start to dial down the conditioning a little bit, with the goal at the end of the day, towards the end of rehab, that a lot of your conditioning work is actually going to be change of direction, agility, game specific work. Okay. So at month 6 to 7, 1 time per week, long, slow, 3 out of 10 RPE. And then 1 time per week, we're working on intervals. And these are going to be faster intervals now. So think about a shorter interval, something like 3 minutes on, 3 minutes off for 4 total sets. So over the course of time, we're just going from a longer interval to a shorter interval with our running, just like we did with our bike. Okay. Once we get to month 7 plus, so let's say we have an ACL reconstruction surgery, we're trying to return that athlete to sport around the 9 to 12 month mark. All right. So this is essentially how I would do that for someone who hits 0 problems along the way. Obviously, if an athlete that's more painful, weaker, takes them longer to progress through this, it can be a little longer than this, or sometimes a little bit shorter, depending on the surgery. Okay. But like I said previously, at this point, we're trying to actually phase out some of the conditioning work and phase in more game specific preparation. Okay. So, one of the things that I do with my conditioning is I start to incorporate a lot of agility work within my conditioning work. Okay. We're working on making this as sport specific as possible. Okay. So for a soccer athlete, maybe we're incorporating some ball handling drills. Maybe we're trying to keep a work to rest ratio that's very similar to the sport. We may also be trying to bump up the amount of mileage they have from session to session to session, just so we can kind of mimic game time situations, how many miles they have to run, how fast they have to run, how many times they have to do that throughout the course of the game, how much rest they get. All those variables become really important. We want to try to make our agility, change of direction, running as specific to the sport as we can as we progress closer and closer return to sport. Okay. We know that readiness is a huge problem for athletes when they're returning to sport. They just don't feel like they're ready to actually play again. But I think one of the major reasons for that is because they're not exposed to a similar game time stress. If in physical therapy, your athletes are running for, let's say, 60 minutes and they're doing the same mileage they have to do in a game situation, and they're actually handling the ball and doing drills that are very specific to what they're going to encounter within their sport, they're going to feel a whole lot more ready. So I just think that if you do a good job with your conditioning and your physical therapy in general, your outcomes are going to be better. Athletes are going to feel better prepared, and they're probably going to be less likely to get hurt when they return. All right. So I know I promised you guys I would try to put it all together. What do I mean by that? Well, we have a lot to try to fit into a rehab program. All right. And I get it. It's a lot. And if you do just a fraction of these things, I think you're going to do better than most physical therapists. But how do we put together a return to run program, some plyometrics, agility work, acceleration, top end sprinting, conditioning, and then a bunch of strengthening on top of everything? Okay. It's tough. So largely, I want to give you an idea of what a training program would look like for, let's say, a post-op ACL reconstruction. We'll go kind of month by month. We're going to start at month 3.5 because that's when I start my return to run programs generally with these folks. Again, it depends on the surgeon, depends on the individual. But let's say you start around 3.5 months. Okay. So what does a typical training week look like? And keep in mind, you're not going to have your athletes 6 days per week, probably, as a physical therapist. So largely what I'm expecting my athletes is I do the more challenging physical therapy days in the clinic. Okay. And then the easier days, like let's say return to run program, I don't think my athlete needs to come in the clinic to do that. I watch them run first, make sure they're not doing anything silly, but then I largely will prescribe a lot of exercise for my athletes to do on their own. Okay. So keep in mind, again, 6 days per week is what we're recommending here for athletes. They're trying to get back to high level sports. However, you're not going to be doing every single one of those days for most clinicians. All right. So let's say we do strengthening 3 days per week. And usually I will put in my plyometric and agility work on the same days as my strengthening. So let's say I'm doing plyometrics and agility on Monday, Wednesday, and Friday. And on the days in between, so Tuesday, Thursday, and Saturday, I am doing my return to run as well as my bike conditioning. All right. Now, I think from a long-term success perspective, we probably want to split apart our conditioning sessions and our strengthening sessions, just because if you put them back to back, they're probably going to conflict with one another. So you're not going to get the best outcomes for your strength, your power, as well as your conditioning. So if we can split them apart, I think that's helpful. The other piece is that we're always trying to avoid training spikes. So if largely you only train Monday, Wednesday, and Friday, and you have an enormous volume each day, that represents a training spike to me on each day that you train. If you split that up a little bit, have your strength on one day and you have your running on the next day, it's a nice even amount of stress for that healing injury, that surgical site, whatever it is, throughout the course of a week. So that's my preference. You just have to keep in mind that some athletes won't be able to do this, but you try to make it as even as you can and just work with them over the course of time. So month 4.5, how do things change? So largely our Monday, Wednesday, and Friday, they stay the same. All right. So we have plyometric and agility work as well as strength on each day. Now, obviously, you're just going to advance your exercises. So the strengthening gets more challenging over the course of time. Loads increase, speeds increase, all that stuff. And then the same thing goes for your agility and your plyometric work. So you're starting with easier variations. You're just progressing over the course of time. But the setup stays the same largely for me, at least at this stage. Then on Tuesday, Thursday, and Saturday, we're still doing our conditioning work. However, we're starting to introduce our sprint work and our acceleration work. Okay. So largely we started with a return to run program. Once athletes are tolerating that really well, we introduce some higher speed runs in the form of fall runs, in the form of build-up runs. And these are going to fall on the conditioning days. So on Tuesday, we do our sprints and acceleration. Afterwards, we finish up with a long, slow run. On Thursday, I'm doing some conditioning on the bike, right? So we're kind of bridging that gap between cycling and running. So we can't do all running all at once. So we're doing a little cycling and running combined. And then on Saturday, we do sprints and acceleration and our long, slow run again, right? So you can see how we're slowly leaking in some higher speed runs and we're slowly leaking out some of the bike conditioning. Month 5.5, things actually look very similar to month 4.5. Obviously, again, the plyometric, the agility work's getting more challenging, strengthening is getting more challenging. And the only thing we changed on our run days, which are Tuesday, Thursday, and Saturday, is now we're doing our run conditioning on Thursday. We've completely phased out the bike cycling. If you have an athlete that does cycling as their sport, then obviously you can keep that in. But if you're trying to get your athlete back to a field sport, we need to progress some more running. So this is when I generally eliminate all the cycling, and this is where we're focused on running for our speed work, conditioning, so on and so on. Month 6.5, again, is very similar, at least in setup. Everything is advancing. In terms of the running and conditioning, you'll notice that on Thursday, now we have some track work and interval running. So as we described earlier, we go from a longer interval to a shorter interval. Eventually, we have to introduce high-speed running in the form of conditioning. A lot of times I do that with track workouts. So you're noticing that a lot of the running is getting higher in speed. We're also trying to make it a little bit more sport-specific, because if you're playing soccer, it's not like you sprint 5 times and you're done the game. You sprint several times, across the entire game. So we're just trying to make our rehab programs more specific to sport. And lastly, when we get to around the 8-month mark, I'm thinking about getting this athlete out of physical therapy and basically back to playing their sport, back to training with their team, all those variables. Okay. So I made this presentation thinking about, let's say, an ACL reconstruction where they're trying to return to sport around the 9 to 12-month mark. All right. Largely for other types of surgeries, it's going to be a lot faster. And obviously, you can speed that up for the given athlete. But I just want to give you an idea of what it may look like for, let's say, those post-op ACL reconstruction patients where the rehab just takes forever. And it's a very slow, progressive, gradual buildup. Okay. So once I get to that 8+ month mark, I'm thinking about introducing more sport-specific work as well as actually practicing with the team. Okay. And what that means is as we introduce more practice with the team and more game-specific drills, we're actually phasing out physical therapy, okay? So usually I'll go from, let's say, 6 days per week worth of conditioning, worth of strength work, worth of plyometrics, sprinting, and I'll go down to, let's say, 3 days per week and have them go actually play with their team 3 days per week. Okay. And as we progress further and further, obviously it's going to be a little bit less of the physical therapy and more of the sport specific training. One of the things I also do at this point is ask a lot of questions about what the sport team is going to be doing from a strengthening and conditioning perspective. Are they going to be returning to a program with their college, with their university? How do we bridge that gap between what they're doing currently with physical therapy and what they're going to have to be doing with their strength conditioning, right? Same thing goes with conditioning. Will the athlete have to get back to, let's say, some sort of VO2 max test? Are they going to be tested with their conditioning? What do we have to do really well as physical therapists to put those last finishing touches onto the athlete's rehab program so they have a very smooth transition from rehab back to their sport? If you guys enjoyed this lesson and want to learn some more, I have another video for you. It is going to be an evidence-based guide to the treatment of patellofemoral pain. So if you're working with athletes that are having a little trouble running, this is a video for you. Check it out. If you guys want to check out the references, I do recommend reading through some of these articles. They were very helpful for me as a clinician. I'll leave a link to all of these in the show notes, and you can check them out. And lastly, thank you so much for your support. You truly allow me to do what I love for a living. If you're watching this on YouTube, please hit that like button, comment, and subscribe to the channel. It helps me out tremendously. If you are listening or watching the podcast version of this, please leave me a positive rating and review. Again, helps me out tremendously. If you want to go that extra step and support me further, consider subscribing to Fitness Pain-Free Insiders. It's a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for trainers and physical therapists. You have premium content from me, very similar to what you're watching right now, but more in depth. You get updated monthly webinars delivered via me. You have over 100 webinars, ebooks, and complete guides at your disposal. You have access to a private Facebook group to have all your questions answered by me. You can decide upcoming podcast topics. And the best part is you can get started for just $1, right? And lastly, you can cancel anytime. If you do cancel, I'll be a little sad, but that's okay. I'll leave a link in the show notes, but if you want to get started right now, head to fitnesspainfree.com, click on the programs link, and then click on Fitness Pain Free Insiders online library to get started.